Hello, good morning, everybody. Welcome to the 20th edition of the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health systems design expert. I'm really excited to welcome our guest, Deepa Iyer, today. Deepa is a South Asian American writer, strategist, and lawyer. Her work is rooted in the Asian American, South Asian, Muslim, and Arab communities, where she spent 15 years in policy advocacy and coalition building after the wake of the September 11 attacks and the backlash. Currently, Deepa leads a project on solidarity and social movements at Building Movement Project, which is a national nonprofit organization which helps catalyze social change through research, strategic partnerships, and resources for movements and nonprofits. She also hosts her own podcast, The Solidarity Is This podcast. She's an author of 3 books. Her first book, We Too Sing America, South Asian, Arab, Muslim, and Sikh Immigrants Shape Our Multicultural Future, received the 2016 American Book Award. In 2022, she published Social Change Now, a guide for reflection and connection, which was based on the social change ecosystem map, which we'll talk about today, that she created. And then recently in 24, she published a kids book, which is We Are the Builders, which my kids love, by the way. So thank you for that. Thank you so much for joining me, Deepa. Great to have you on.
Thank you so much for having me, Gaurav. I appreciate it.
So I love talking about these ideas which bring about change. And I like to get there by talking to people about what were some of their life experiences that led them to the way of thinking that they're at today. Do you mind telling us a little bit about early life before you first start thinking about professional school or work?
Yes, sure. Absolutely. And I'm sure as a psychiatrist who works with children, that is something you're very familiar with. I think for me, I would say that a lot of the questions that I still grapple with are absolutely rooted in my childhood experience. And particularly my experience of immigration. My family and I moved to Kentucky from Kerala, India, when I was 12 years old. So I had really lived in India for a significant period of my childhood and then moved here as an adolescent. And so a lot of the experiences of really not fitting in, not understanding a new culture, being in the South, where issues of race have always been contested, were all issues that I faced and my family faced. So those have been sort of the primary, I think, influences for me choosing some of the different paths that I've taken since.
So when did you first start thinking about what are you going to do professionally? And
Wow. Well, I think for me that at a very young age, I was really drawn to books. And even when I was growing up in India. So for me, books were sort of the way in which I could immerse myself in a different type of experience and learn about experiences that I didn't have. So from a very early stage, I would say that I probably said I want to be a writer. And that I think has been a core part of my my identity and my life, even though I've come to it in different ways.
can you think of books that influenced you growing up that you still think, okay, that made me change how I thought about things?
Wow, that's a good question. When I was much younger, I wasn't necessarily reading books that changed me as much as they changed my idea and understanding of the world. And I used to read a lot of books in India that were written by British writers or American writers about families that looked nothing like me. And then that was balanced with like Amar Chitra Kathas and sort of very traditional books you get in India. So there was this sense of like, do I ever see myself in what I'm reading? And I have learned over time that when I got older, and started reading books that were a little bit different, I would really be focused on books that were about people who didn't necessarily fit in. So one kind of critical seminal book that I remember is The Outsiders by S.E. Hinton, which was a book that really, I think, shaped me at some level.
I think you decided to go to law school. When you first started thinking about law school, were you already thinking about work in the social change space, or was that later?
So I think that I've thought about issues around inclusion and equity, what we would call those issues now. When I was in college, I was really involved in a lot of student organizations.
Mm.
that were focused on students of color, so Asian Americans, Indian Americans, and the like. And I was also involved in efforts to expand our curriculum so that it was a lot more inclusive. I was a literature major. And so, reading books that went beyond the canon of what you usually read in your English classes. And so I was really focused on the need for inclusive stories, inclusive curricula, and inclusive student bodies. That was something that was always on my mind, even in college. And I think through law school, I got really interested in, and law school is not, it's not an easy sort of process to go through. You do have to read and know a lot of the foundational jurisprudence. But what
Right.
I slowly began to understand is that the law can be used in different ways. It's not
Mhm.
neutral. So it can be used to empower people with their rights, or it can actually be used to take rights away from people. And I became interested in topics like constitutional law and immigration law and civil rights law. Those were really interesting to me. Coming out of law school, it was in the late 90s. And I didn't really know what it meant to build a
Mhm.
career
Mhm.
around those types of issues. So it took me some time to get to where I landed, which was in the nonprofit world and in the nonprofit sector, and specifically working on advocacy and policy at the national level in Washington, D.C. So slowly kind of found my way to the nonprofit sector and then to federal government and then back to the nonprofit sector where I've been for most of my career.
Right. I'll say even in the medical field, which is at times people think obviously we're trying to help people. That's what we are in this for. Though the way you think about helping people early in your medical school and the career is different than what you realize you actually have to do later. So I tell people like, medical school may make you a doctor and it doesn't make you a good doctor. For that, you actually have to work and
Practice.
practice and done a lot of work in the community health space and underserved areas of our country. And you realize that there's a day I remember, okay, homelessness is a bigger issue than any other medical ailment they're walking in with. There's so much else going on in people's lives and then hopefully then you can use that medical setting to support other things that people are needing also, and not just the diagnosis we're looking at.
Yeah. I love what you said because I think it can be related to the law or policy as well. I mean, there's this sense from what you said of actually understanding context. People aren't just walking in with, I have a really bad headache. What is the context that they're coming out of is important. And then there's also this intersectional piece around understanding that different aspects can affect a particular, as you say, diagnosis. And in the legal arena, it's similar because when you're talking to someone about, like a claim that they might have in the workplace, it's really important to also understand what is the broader context. What else have they been dealing with? I think that's what makes you a more skilled, holistic responder rather than just focusing in on problem solution.
In the healthcare space, though, what you described and what we're talking about is you have to just go the extra mile to do that. It is not set up for you to actually consider all the contexts that bring people to you. Do you think in the legal world also is that similar? Do you have to go beyond what basic work you would do to just consider all of those things?
Yeah, I think so. And I think that I think you learn over time that, especially if you're working with, say, vulnerable communities, if you're working with immigrant communities, it would be bizarre if you're even counseling someone who is a
Okay.
young immigrant to
Yeah.
not talk about the context that they might be living in right now. So, where does that fear and anxiety come from that they're presenting, or where does the particular physical ailment, what is it connected to in terms of the broader climate? I think that some parts of these professions are probably more attuned to asking those questions and others might not be. But yes, I do think it takes the extra mile. And also, it points out some of the deficiencies within our ecosystems. Like in the legal system, it isn't necessarily set up in a way for you to actually understand the holistic aspect of your client. So you have to push against the system as well.
It's a question about real problem identification. I think it could be you could do it very simplistically and not accurately because of that, or you could actually take the more complex picture of somebody coming to you for help, and it is a complex picture. So let's not simplify it too easy.
Yeah. Absolutely.
Tell us a bit about your work at the Building Movement Project.
Yes. And so the Building Movement Project is an organization I've been at for about 7 years now, and we're a national nonprofit. We've been around for 2 decades, and our focus is to catalyze social change. And we do that by doing a lot of infrastructure work. So we're not always on the front lines, but we're doing work such as doing case studies and research about trends that are happening in the nonprofit sector, or we are facilitating and providing resources for organizations and networks that are contending with a problem in their communities. I specifically run a program on solidarity practice. So the questions we think about are, how can we create and buttress the conditions for deeper solidarity that is not just transactional, but actually transformative in some way? How do we contend with a lot of the biases that prevent solidarity from happening? In this moment in particular, where people and institutions are more prone to self-preservation and protection instead of taking a risk to speak out in favor of someone else, how can we support the ability to be more courageous and to take those risks through resources, through education, and through other forms of support? So in addition to the podcast, which is more of a narrative space, we also work really closely with organizations and institutions around the country. We support networks, and we are really focused on providing trainings and education as well.
The infrastructure work is what excites me also in healthcare, building health systems which are work really well for our patients, of course, but also for the front line who's caring for them. Because oftentimes the gaps you see is not because somebody who's trying to work with a patient is not wanting to do it. They're just set up to not do it well, right? Um, have you so the infrastructure work I'm guessing is also for the team members themselves and not just for the consumer or customer who they are trying to
Right.
serve.
Yeah, it's mainly for the organizations that are supporting the community. So it's about, what are the systems, what are the policies and practices, what are the agreements, what are the skills, what is the infrastructure that's needed to buttress that organization or that network's ability to be responsive to the community.
I'm sure you work with healthcare organizations too in the nonprofit space.
Yeah, some. I mean, I've definitely used the social change ecosystem map, which I know we're going to talk about a bit, with either public health agencies or people in the public health realm to understand better what are the different roles that they can be playing in the public health ecosystem, and how can they do that in a way that's supportive of the community and the values that they care about.
The other question about nonprofits, I think, I've spent essentially all my life working in nonprofit space, in the county space, in the federally qualified health center space. I think when the times are tough, for sure, risk taking and thinking out of the box gets much smaller. But even when times are okay, risk taking is not. Many nonprofits don't do that work, like especially in healthcare, because I think it's all essentially tied to funding streams. So I don't know if you've seen that or.
Yeah, absolutely. And I think it goes across, a lot of different types of institutions. Yes, I think that it's interesting, in the nonprofit sector, the reason that we enter the nonprofit sector, I think generally, is because we're trying to solve a societal problem in a different way. We're actually trying to experiment. We're trying to bring in context. We're trying to understand the intersectional elements. But because of some of the factors that you mentioned, I think that a lot of time the work becomes about the deliverables. What are the outcomes, that we need to see X amount of patients, we need to do X amount of campaigns, whatever it is. And the deliverables become way more important than how we do the work. And so that's one area where it happens. And then secondly, because as you say, of the influence of like funding streams, I think makes it really tough for nonprofits to actually get back into the experimenter space or the visionary space. And instead, they're just trying to keep up with whatever the grant proposal asks them to do, right? So it's one of these situations where I think we have a crisis of imagination. And I think it's because we're not actually able to oftentimes stretch ourselves and to create the infrastructure we need in order to meet the crises that are in front of us. we're just stuck in these patterns over and over.
Yeah. And what I've been thinking and what I've seen is also how a way of thinking, a way of doing things solved problems 20 years ago. And if we use the same strategy today, even though back then it was the best way to do things, the needs of the people we're trying to serve is so different today that you have to be an experimenter to do it well today. The same strategy is not going to work. Let me ask you about the social change map and the framework that you created, right? Because it resonated with me, and I was trying to identify with all of the criteria. What was the reason of you starting to think on this and create it?
Some of it is actually what we've been discussing. I think that after working in the nonprofit sector for 2 decades, became clear to me that a lot of times the work we were doing was not actually as effective as we wanted it to be. And it was very incremental, the change that we were seeing. So that was one reason. So I was curious about what is the infrastructure that is needed to do this work in a more long-term sustainable way. The second was I was seeing a lot of people burn out and get extremely fatigued and exhausted doing social justice work or nonprofit work. And then the third is that when I developed it, which was in 2017, the country was in a time of national crisis where we were seeing, family separations. We were seeing other types of civil rights violations. And so it was like, how do we respond to this crisis moment in a way that also allows us to build for the long term? So these were some of the questions that were on my mind. And, after like doing a lot of research and interviews with folks, and also just my own experiences working in the post 9/11 backlash time, this framework sort of emerged. And it's a very intuitive framework. It's really simple to understand. It has three elements to it. The first is that we are really asked to think about and clarify our values. And I don't know if in the medical field, there are conversations about values, but in the nonprofit sector and in the social justice sector, there are a lot of conversations about our values. But there's often a dissonance between like what we say on our website and how we practice those values. So getting clear about values is one thing. And then the second is to identify the various roles that we can play, either as individuals or as institutions. And then third is to understand that we're connected to each other, that it is an ecosystem, much like the body or an ocean. Social justice and social change work also has to involve a lot of different people that are connected to each other, that are trusted. And so those are the three elements of the framework, and different types of institutions and sectors have used it over the last many years.
I'm definitely curious about all. I think the three: the disruptor, the experimenter, and the visionary. Can you talk a little bit about how do you distinguish between the three?
Yeah, absolutely. And it's also very common that we say, I play all these roles. And it's often true that we probably do, but the question there is, or the awareness is, we don't want to be playing 8 of those roles in one ecosystem. We might have many different ecosystems we're part of where we play different roles, but if we're playing almost all of them in like our workplace or whatever else, then we are going to get really close to being fatigued, and we're probably not very effective either. But those three particular ones you mentioned, visionaries, are really those of us who see the North Star. We can say this is where we need to go, and we can inspire others to come with us. We see the different types of ways in which health services could be rendered, or we see that mutual aid could look a certain way. So we have these kinds of visions about what could be different. And then disruptors are those of us who are ready to speak out in different ways, where we are oftentimes, going back to what you said earlier, ready to take some risks. Being a disruptor often comes with some reputational harm. People don't always like disruptors. And that's why I use that word on purpose, because I think it's important to reclaim the value of disruption. But when we disrupt, and that could be maybe Disruptors are folks who are on the streets organizing a rally, for example. They're sometimes very visible, but they're also people who say, we don't have to do this the same way we've always done it. Let's try something else. That's also a form of disruption. And then the third one you mentioned is experimenter. Visionaries and experimenters really can work together very well, because experimenters are those of us who say, I've got a different way of thinking about this, and I know what to do. The disruptor might say, we can't do it the same way anymore, but the experimenter will say, well, I know what actually we can do. And as long as the container is one that enables experimentation and values it and supports it, experimenters can really, really kind of take us leaps ahead if they're able to play that role.
I think with that, with that explanation, I probably fall into this disruptor space because, I've had conversations which, in a closed room, people would agree with it, but then not many of them would be willing to say it in a forum. And then I've had questions of like, why are you saying these things?
Right.
By
That's definitely disruptor. Yeah.
I feel the best value I can offer is actually to speak up when I don't think something is right. Because if I'm not doing that, I feel like I'm not even doing my job there. You're not using me to the best of my ability. Not saying that I'm always right. I'm open to be proven wrong for sure. It is funny. When I first moved to the country, I was starting my residency in Detroit, Michigan, and I moved to this country as a physician. So I came with that privilege already. And I remember my program director in my year one calling me in and saying, you're too dogmatic. And in that moment, I didn't know what dogmatic meant, but I know I have good EQ, so I knew it was not a good thing to be. So I said, I'll work on it. And I looked up in the dictionary the moment I left. And it almost, I feel like it shut down my opinions for almost like 8-10 years. I kept a lot of my opinions to myself. And then I realized a few years ago, I'm being dogmatic again. And people like it. People like the opinions I'm sharing.
Yeah. Thanks for sharing that. That's a great experience. And I love that story of looking it up in the dictionary. I think sometimes that it's also about the way in which we disrupt. So that, people generally don't like it when folks say, I've got another opinion about this, or we shouldn't say that, or this is not right. And I think that what I've seen when I worked with folks who are disruptors is when they actually approach disruption in particular ways. So I'll give another example that's a little bit different, but I think you'll get the gist. There are lots of times when disruption happens in social movements where, for example, like a highway is shut down because the protesters are trying to make a point. I noticed a couple of years ago with that kind of a disruption happened that these protesters also passed out these little slips of paper to everyone in cars. And it said, first, it started out by saying, we're sorry. We know that this is inconveniencing you because you need to get somewhere. And we're really sorry that we've inconvenienced you. And we hope you'll just take a minute to understand why we're doing this. And I think there's something about that where it says, it doesn't say you have to listen to me because I am right, in that dogmatic way. It's more that, yes, I have something to say, and we know this might not be landing with you in the way that it should. But acknowledging that, I think, goes a really long way with disruptors, so that it's not just about their opinion being heard, but they're thinking about how it's landing on someone else. And so that can actually help to soothe some of the ways in which people respond to disruptors. And I think another way is that we don't just want to disrupt and dismantle, we also want to build and suggest a better way of doing things. And so sometimes disruptors aren't able to do that. So that's why on the map, it's really important for them to work closely with builders and visionaries so that they're not just burning something down, but they're also offering a better way, a better alternative for folks to consider and not putting that on someone else's plate.
Right. That totally makes sense. I think so. I think that's about leading with empathy for the person who may not share, as a disruptor, may not share your point of view completely. Oftentimes, it's not because they don't agree with the point of view. It's oftentimes they're stuck in a place that they are not able to exercise that. And also within the institution, I think disruption needs to come with ideas, not just let's disrupt, right? It needs to come with solutions which are different. So I think some of that responsibility will be on the disruptor.
Oh, yeah, absolutely. Yeah, every single one of these roles has a responsibility. And that's why I often talk about this framework as there's a little bit of self-awareness that is involved with it. And in the book that I've written about the framework, there's a chapter on each role, but then there's a list of, how can this role grow? How can it actually get better? And there are some tips and ideas around that. And there's a lot of prompts and reflection questions about, what is the toll of playing this role? How does your ecosystem react when you play this role? What is your aspirational role? Because we do need to be not just saying, I'm a disruptor, I'm an experimenter, but thinking about what is the best way of showing up in that role. And a lot of that relates to the broader community that we're in connection.
I definitely recommend everybody get that book because I think even just looking at that framework, it just starts making you think in different ways than you have before. And also divides up roles. There are 10 options. There's a lot of options. And I think that's good because there is a lot of nuance in the kind of work, definitely in healthcare and I'm sure other industries. So, let's talk about your recommendation for somebody who's working in any of these industries, who is filling out their paperwork, who is submitting their thing, and they have to get these tasks done. There's a lot of tasks in their work. That person is already kind of burnt out, probably underpaid in the nonprofit sector. How do we get that person? Because everybody who's aligned, that's easier to bring on board. How do we get this person aligned with this framework and thinking? And how do we want them to think about it big picture, but also like everyday interaction?
Yeah. Well, I mean, first of all, in most nonprofit arenas, you're working as part of a team. And so, one of the ways that this framework might be useful is to map the roles on our teams and to identify how many of us are builders, how many of us are weavers, etc. Because what that enables us to do is to understand what are the assets and skills and strengths on our team. It helps us to understand what additional professional development might be necessary for someone to play their role more effectively. It also helps us understand potential collaborations between team members. And in the situation that you talked about, where that person that you talked about, I think is more of a builder, like really focusing on the minutia of the tasks. And a lot of us come into these spaces and we are builders. We have to start there. We have to do some builder work, the foundational work. It can get very easy for folks like that to get mired in the weeds and not see the big picture. And so mapping the team can enable the builder to seek support from a visionary or to work more closely with a storyteller. So there are ways in which we can maybe get out of the rut that we're in by actually connecting with others who might be playing roles that supplement and complement ours in a different way.
Yeah. And one of the other roles I was really thinking about, I don't know if it's necessarily my role, but I know it's a big gap in healthcare, is the role of the weaver. The reason many of our patients fall through the cracks in our system, and, especially I'll talk about mental health, a patient who may have mild, moderate depression is supposed to go to this kind of health center. And then they have more severe depression or a psychosis or need hospitalization. The payer system is totally different. And clinics they're supposed to go to, they don't always, but it's very different. And there is no funding for the weavers in between these two systems to make sure the patient transitions and back transitions well. And it's such a gap in the health system, and it's almost intentionally created this way. And the weaver piece is, in my opinion, the biggest problem in our healthcare right now.
Absolutely. I mean, the healthcare system to me seems to be one of the most siloed systems out there. And so this framework is all about how we move beyond the silos to create connections. There's no way, that if your primary doctor doesn't know what like a specialist has recommended for you, that you might have the same sort of interactions and understandings about what's going on in your body. That's just one example of the need for that kind of connection. And weavers are very important because what they do is that they can be the linchpin and the ones that create the through lines between the siloed entities. So imagine a weaver being someone who says, it's like a patient coordinator role, who says, I know that this patient has all these different health issues. They're going to all these different doctors, but I'm keeping track of it for the patient's own outcomes. Not right. So I know how they're interacting with different healthcare providers, or I know that we need to have a conversation between these two providers. It's that coordinating role that I think is so important. And often we place that on people who are already doing another role on the map. And in my space too, where a lot of it is like, well, the organization that's working on racial justice is not just working on racial justice in their community, but they're also asked to then do coordination with like 4 other communities. And so unless you have a designated weaver who can facilitate that, there's no way that you can do the work you're supposed to do and do the connectivity work as well.
In healthcare, I'm sure some of other nonprofit space, it's like the work you do is not that important, but here's more work for you.
Yeah, that's the message.
It's not that important, so your opinion is not always seeking it, but here's more work for you, and not more pay or training even. You know, the other piece is I changed my thinking on this recently. It's not people are creating silos. I think silos are natural phenomenon that in an organization, when you're trying to do very specific work, a silo is the natural outcome of that system. And you have to actually build in anti-silo, which is Weaver is a way to do it. You build in that into the system for it to not happen. Otherwise it will happen.
It's a natural thing that we do. Yeah, we're like, we have to be in our lane. We have to focus on this project. Everyone has to buckle down and do it. But what often happens when we do that is that one example I often give is, we can be working on something within our institution, but we're not able to actually tell the story to our constituency or our base or our clients. They have no idea what we've done. They don't understand the language. They don't understand what we focused on. So there has to be a feedback loop. There has to be a way of interpreting what we're doing. And
Right.
that's where weavers who can also play the storyteller role can be useful, as well as what we talked about, the weavers who are doing the coordination internally across systems.
I've been asking a few people for advice now. I'm in San Diego. I work in the juvenile hall here a couple of days a week. And as you would expect, unfortunately, there's so much revisitism. There's so many kids who are in and out of that system. I've been there, 6 months, but almost everybody I see, even if were new there, they were there 2 months ago and they just got released and they're back. This is probably 80-90% of the kids we are seeing there. And these are kids all the way from 12 to 25. So this commitment, kids who have been, I guess, sentenced as minors, but they've got 7-8 year sentences. And my role right now is I'm a clinician. I'm seeing patients. That's my role. That's my defined, identified role. And sometimes the system wants you in that role. So how do you infuse some of this framework? I'm a systems thinker. This role, I enjoy it because as a physician, I enjoy the patient care work. So it is very grounding. And I see this one kid, I talk to them. And when I finish that interaction, I've done the best of my ability, what I can do. But I know the problem is way greater than I can address in that session. How does one think about practically in that one setting? Maybe just as an example, how do you think about this framework in that setting? Like, what else can you do?
I mean, what I think you're saying is that we can be doing our work with individuals the best that we can, like frontline responders who are perhaps working with unhoused people and making sure that they have food. But then the problem, as you started off talking earlier around homelessness, is much bigger. Like, are we making a dent in it with the one-off work that we're doing with our clients or the people that come in or the young people you talked about? I think that's a challenge that a lot of us come up against. And we recognize that no matter what we do, the system is set up in a way that continues to churn out the same outcomes over and over. So a couple of things. So one is that in this framework, I think that people who are able to be visionaries, working really closely with disruptors and working with experimenters could shift the system. But what it requires is someone to first say, this isn't working. That's a disruptor. No matter what we do, we're not actually making a dent in this problem. And we're doing harm. There's harm for the people that we're supposed to help. So that's one. That's like the disruptor piece. Then the visionary has to be able to then say, there's a different model, there's a different approach that we can take. And then everyone will get super stressed out, because to do that means to shift everything that the soup they've been in for decades. And that is where you really need visionaries who are able to say, we know that it's going to be really hard to make the switch, but we have to. And then builders and experimenters and storytellers and weavers come in to play their roles in creating the new system, in making sure that they can interpret it to the outside world, in making sure that there are no more silos. So oftentimes it's a complete shift. And I think we have moments in our country, like the pandemic, for example, where there was a moment where public health could have shifted. But my understanding and what I've heard from folks in the public health and medical arena is that we didn't take that opportunity. I don't know if you would agree with that, but that's where I've talked. It's a failure of imagination and a failure of courage.
Completely agree. I think, I talk about humility and courage because humility makes you ask and question. If you don't know everything, at least acknowledge that. So if you can't think out of the box, you'll ask others to help you think out of the box. So I think that, and courage, obviously, let's jump into the problem. During the pandemic, I work in San Diego, a relatively rich city of the US, first world. I knew for sure on day one of the pandemic that there are many of my patients who work 2 or 3 jobs, and the transition to telehealth was an amazing shift that really improved access to a lot of people. But we said, oh, if you're sick, stay home. But am I going to put food on the table for my kids or stay home? That was the question. And so the system was not serving these people at all. Whereas my parents in Bangalore, they tested for COVID, and within 6 hours, like a care kit with medication, everything they needed was stolen at their door. I don't know if this happened all across India, but definitely happened to them in Bangalore, India. So I think that's happening in India, and that's nothing like that is happening in the US here. So I think absolutely there has to be a reimagining of how things are done and care is being delivered or prevention is being delivered.
There are examples like the one you said, in India. And I also had family members who shared the same story with me in different parts of India. But, there are examples, whether it's around the world or even in our own country. I mean, we saw in the pandemic, a lot of mutual aid associations come up, like where, like my neighborhood, people were helping elders by going to get their groceries. There are things that we can do, but they also then need to be systematized in some way, and they need to be funded in some way too for them to last. So it's about the scaffolding in times of crisis that leads to long-term infrastructure. And I think we tend to crumble because a lot of these systems are so entrenched. It's really hard to imagine like what it would be like without them. And so, but I think we are being tested in our country over and over again with crises that are forcing us to say these fractures and fissures, they're revealing a lot. And so we either can just stay in them and put the band-aids on them, or we can actually find different portals. And you know what I mean?
Oh, it's all band-aids. We need leaders who, in the time of crisis, are not going to panic, because that's a lot of it is that. Like, and let's get an answer quickly. Anybody who talks too rapidly and has very simplified answers to a complex problem, have you even thought this through fully? You see a lot of that, and you need a calm head managing that crisis. This is such an exciting conversation. Actually, we're coming to our last question. So, what is the most exciting and challenging problem you're working on today?
Yeah, that's a great question. So I mentioned that I work on solidarity right now. That's a lot of what I think about. And I think that for me, the most challenging part is like, how do you build solidarity in a country that is so fractured and polarized? How can we find connections between ourselves? How can we see each other in a different way than we do? How can we do this when we have policies that are deporting people, that are denaturalizing people, that are, kind of telling people they can't come here for asylum or refugee status? So when we have a politics of exclusion, how do we build and deepen solidarity? So that is the challenge. But it's exciting because I really believe that it is in moments of crisis and fracture that we can push ourselves beyond the status quo, because we have to. There's, as Dr. King has said, the urgency of now. And the urgency of now demands us to come up with better ideas, to push ourselves further than we thought we could. And so that is the place that I'm in most of the time.
Okay, so actually, now the really last question: which of the 10 do you identify with?
Yeah. So the other part of this framework is that we're supposed to shift our roles depending on the context and our capacity. We don't want to be stagnant forever. And for myself, I know that I tend to be gravitating towards always the frontline responder role. So I can kind of be calm when there's chaos. People often come to me to say, like, something's happened. How do we respond? Right. That is my usual role. But I've also realized that when I play that role without any boundaries, I tend to get numb. I tend to not be present. My decisions are not as sharp. And so I've learned to set some boundaries around that role and instead be a storyteller. And so I write about frontline response, or I am a guide and I support new frontline responders. So so right now I think I'm more of a storyteller and a guide. But I've used to be a frontline responder. And there's some, I'd be curious if you see this, but there's definitely some like internal family system stuff that people have said they see in these roles too. And I think the way that I think about it is also like who's in the driver's seat, who's actually coming up, thinking of that IFS model a little bit. And that can also help us understand, am I taking up too much space by playing this role? Or is this role tied to some like cultural bias that I have lived with that keeps coming up? So it can also, I think, offer some ideas and be complementary to some of the work that some of us are doing with therapy and healing.
Yeah, so many things that came came out of that in my head. I personally also have seen that going from the builder mode to identifying young clinicians and leaders and telling them you're great builders. I want you to also guide
Yeah.
for the next group of people coming up, and also then becoming a guide myself, stepping back and let people do it their way and fail, which is also one of the toughest parts of letting them do it their way. But I think that's a hugely important piece of leadership. I also completely resonate with, is my framework of analyzing this problem still accurate? I was thinking about a problem about some weaver problem in the system. I thought about it very similarly that I had 6 years ago when I started. And then I realized, oh, the facts have slightly changed. I need to. So that's also a great thing to just be aware of, which is the hardest, I would say, reevaluate if your thinking frameworks are still accurate.
You have to do that. And I think that that's part of, as you said, leadership. It's part of design thinking, systems thinking, because I think the stagnancy and getting used to the status quo, those two things are kind of death knells. Because that means we're not thinking about the context, we're not thinking about how our community has changed. And those are ways in which we can really, I think, harden these systems in a pretty unnatural way.
Getting out of the way sometimes is the answer.
Sometimes that is the answer. Yeah, sometimes it means getting out of the ecosystem and, going into another one.
Great. Thank you so much, Deepa. This is a really amazing conversation. I think it makes so much sense in healthcare, and I'm sure all other social justice and a nonprofit space. So I appreciate your time today.
Yeah, well, thank you. I appreciate you like reaching out to me and really enjoyed our conversation.
Yeah, thank you so much.